If you feel like your seasonal allergies are starting earlier than ever and lasting longer, you're not alone. We've definitely noticed that as we're getting less deep frosts and earlier warm weather, the pollen seasons are starting earlier. So the deep freezes are help to keep the plants kind of without pollinating. As the weather warms up, we start to see those plants flower earlier, and the longer they have a flowering season, the more pollen they're releasing in the air, which can cause a lot of allergy symptoms.
Right.
My name is Dr. Monica Kraft. I'm an allergist immunologist at The Ohio State University Wexner Medical Center. Knowing what allergy triggers you have can be a big part of avoidance of the allergies. We know that when it comes to treating environmental allergies, knowing what you're allergic to can help you identify keeping, for example, your pet out of the bedroom, keeping your windows closed if you're allergic to pollen, etc. Common symptoms of environmental allergies can be itchy, watery eyes, stuffy nose, nasal drainage, that clearing you get in the back of your throat, feeling like there's mucus pooling back there, sometimes even itching and fullness in the ears, or lower respiratory symptoms like asthma, wheezing, difficulty breathing, or cough. Common treatments for allergies span from avoiding what you're allergic to if you can, using medications to treat the symptoms, or allergy immunotherapy, which is traditionally known as allergy shots. Allergy medications may include pills like antihistamines, nasal sprays, or eye drops, depending on which symptoms are the most bothersome. The immune system is constantly changing, so it's always possible that you've developed new allergies, particularly if you've moved environments. So if you're coming into a new area and over the course of a couple of years you've noticed certain seasons seem to bother you more, it's very possible you developed a new allergy. Sometimes I also see patients who have lots of symptoms that seem like allergies, and when we do testing, it ends up being negative. In those patients, they're probably having an irritation effect or an irritant effect to the pollen itself. If that pollen is heavy enough to cover our car, it is certainly enough to irritate the eyes, the nose, the throat, even if you're not making an allergy response to it. Allergy testing can really help to pinpoint what you're allergic to and help your doctor guide which treatment is the best for you. For example, if you have allergies to a particular type of pollen that occurs during the spring or summer, you may be eligible to do allergy immunotherapy or injections that help to decrease those allergy response every time that you see it. Those allergy shots can work for dust mite allergy, for mold allergy, for animal allergy as well. Sometimes getting allergy testing also helps to confirm what you already know. For example, if you go over to someone's home that has an animal that you've had reactions to. But other times it may identify allergies that you didn't realize that you had and help you be more aware of what things to avoid and how you can try to target medications with your doctor to prevent those situations. The benefit of knowing what you're allergic to is that sometimes we can target the immune system's response. Allergy shots take exactly what you were allergic to, dilute it down, and build up your body's tolerance to it over time. It's the most natural and targeted treatment we have for environmental allergies. If the idea of allergy shots is unnerving for you, there's also other immunotherapy options. There are certain forms of under-the-tongue allergy treatments, including tablets and drops, that may be right in certain situations to help to decrease your allergy response. Your doctor can go through which specific options would be available to you, but it's always helpful to know from a baseline point of what you're allergic to so that you can start the process to treating and getting those symptoms under control.
Right.
As our climate is changing, we've noticed that environmental allergy pollen seasons are starting with earlier, warmer weather. So certainly when we think about the freeze and frost cycle, the time between the last good freeze of the winter and the first freeze the following fall is extending. So we have longer times where those flowers are pollinating into the air. So different tree pollens, grass pollens, weed pollens are getting into our environment and lasting longer. There's also some evidence with the amount of pollen increasing, it's also becoming more allergenic. So it's making those allergies worse when it's out there. All of this is a reflection of how our general climate and weather patterns are changing, and likely something we're to see more of in the future. Hi there, I'm Dr. Kraft. I'm your allergist today. How are you doing?
I'm doing well, thank you. Nice to meet you.
It's really nice to meet you. And I understand you're here to talk about your allergies.
Mm-hmm.
Sorry if I examine you first.
Sure, of
All right.
course.
Start just listening to your heart, just breathe normally. Perfect. And now I'll listen to your lungs on the back.
Okay.
You can take a few deep breaths every time I'm listening.
Mm-hmm.
Just going to feel your neck.
Mm-hmm.
I'm gonna go ahead and get started, okay?
All right.